My name is Nikita Rajani and I'm a PhD student at the School of Public Health at Imperial College London. I will be talking a little bit about smoking and smoking cessation. According to the World Health Organization, tobacco is the leading cause of death, illness, and impoverishment, killing more than 8 million people across the globe every single year. Statistics show that of these 8 million deaths, 7 million are due to the direct consumption of tobacco, whilst around 1 million is due to indirect consumption of tobacco, for example, through second-hand exposure to smoke. Within the UK, current estimates indicate that 14% of the population aged above 18 years old currently smoke. Whilst this trend has been decreasing over the past decade, as you can see on the graph on the right-hand side, smoking still remains a major risk factor driving death and disability. Some statistics even show that smoking is responsible for 16% of all deaths in the United Kingdom. Therefore, it is vital for public health experts and tobacco control policymakers to continue their efforts to not only reduce the number of new smokers, but also help current smokers quit smoking. There are several different methods of smoking cessation, and these are effectively summarized on the image on the right-hand side of the slide. So the majority of smokers who want to quit smoking try to do so with willpower alone, or also known as unassisted quitting. And whilst this is very commonly used, it is also the least effective method of smoking cessation. Some smokers opt to use nicotine replacement therapy, so this includes the use of nicotine patches, gums, nasal sprays, and these are often available over the counter through pharmacies. Another option that smokers have is the use of pharmacological treatment, so this is the use of prescribed medications from your general practitioner or other health professionals. Evidence shows that having pharmacological or using pharmacological treatment can double your chances of successfully quitting compared to those that try to do so unassisted. Another option for smokers is the use of behavioral treatment. So this includes face-to-face, in-person counseling, which can be both individualized or also done in group settings. Finally, it is also worth mentioning that smokers have the option of using self-help materials. So these can be non-digital, such as information leaflets, but can also be digitalized self-help materials, for example, through smoking cessation mobile apps, which is actually also the focus of my PhD. But according to the NICE organization, the National Institute of Care and Excellence, the most effective method of smoking cessation is a combinatory treatment. So this is the use of pharmacological treatment as well as behavioral interventions that are provided by smoking cessation services in the United Kingdom. Evidence shows that using a combinatory treatment can improve your chances of quitting 3 times as much compared to those that try to do so unassisted. Now that we've briefly looked at some of the available smoking cessation methods, it is important to address challenges associated with quitting or smoking cessation. Research shows that a majority of smokers want to and are willing to quit smoking. Despite this, the rates of successfully quitting, especially in the long term, remain low. There are many possible reasons for this. For example, one reason could be the falling number of quit attempts made annually, and individuals that are making quit attempts are increasingly trying to do so without any assistance. As discussed earlier, this is the least effective method of smoking cessation. You can also see on the graph on the right-hand side that the number of individuals accessing smoking cessation services has been declining since around 2010. A possible method worth further investigating in order to address the treatment gap posed by these downward trends is the use of digital technologies and mobile health to deliver smoking cessation interventions. It is important that we continue to explore methods to improve successful smoking cessation in order to decrease the prevalence of chronic diseases and premature mortality. Thank you.